Hello everyone. I hope all of you are fine and doing well in these times of COVID-19. In my last video I had detailed about how you can check your BMI and know if you are obese or not. Today I'm going to tell you some of the main reasons why everyone should avoid being obese. There are about 38 or 40 parameters, health parameters that get affected with obesity. But I will take the top 10 reasons or top 10 problems that can arise due to obesity. The first and the foremost is diabetes. The second is about high blood pressure. If you have obesity, then you're likely to have high blood pressure. Cancer, obviously, this is one of the most concerning reason why you should avoid obesity. Then you can have heart problems if you have obesity as such. Obesity can also lead to osteoarthritis because of your weight. It can cause infertility, it can cause stroke. There is a high probability of you having erectile dysfunction if you are obese. Then you can also have non-alcoholic fatty liver, which is not because of alcohol, it is because of this. It is because of the fat and you being overweight. Then you have, it leads to metabolic syndrome. I will explain every aspect here, the top 10, one by one, so that you understand that avoiding obesity, you can actually decrease your risk to all these factors and parameters that can actually affect your overall health and your Here is the first of all 10 factors. The number one reason why you should avoid obesity is it leads to diabetes. Let's see how. Obesity occurs when you have a lot of food intake and you don't exercise and you start gaining weight. Now when you take a lot of food, the inside of the cell gets stressed. Here we are talking of endoplasmic reticulum. This is the inside membrane of the cell which gets stressed, which means that you have more food for endoplasmic reticulum to process than it can actually handle. That means too much of food. To process for the endoplasmic reticulum. When this happens, endoplasmic reticulum will send an alarm telling the cell to dampen down the insulin receptors on the surface of the cell. So what happens is when it sends the alarm, it leads to insulin resistance within the cell, and then you will find a persistent high concentration of sugar in the blood. So this is how, when you're obese, this whole system works and it causes diabetes. So I suggest avoid obesity and then avoid diabetes as well. The second reason for you to avoid obesity is cancer. It can be colorectal, breast, uterine, esophageal, kidney, pancreatic, liver, or even gallbladder. Now how does it happen? If you have obesity, you will have something called chronic low level of inflammation. When you have this, then there is an increased risk of cancer to you. When you have obesity, then you have more of estrogen which gets produced, and this estrogen increases the rate at which your cell divide. So what happens is when there is an increase in the rate at which the cell divide, you have overproduction of cells which can lead to cancer. This is basically for breast cancer. Let's see the third reason, high blood pressure. When you have obesity, you have increased fatty tissues. When you have increased fatty tissues, you have increased vascular resistance. Now, when you have increased vascular resistance, then there's a lot of work for your heart to pump blood throughout the body. And then what happens because of this is you have high blood pressure. Now the fourth problem which can arise out of obesity is osteoarthritis. Obesity as such will have an increased weight. Now when you have increased weight, you have a lot of stress on your joints. These joints, when they are stressed, it accelerates the onset of osteoarthritis. Now with this wear and tear of joints, the ultimate problem that will come is you will require a hip or a knee joint replacement if obesity is not taken care of. So this is how actually it leads to osteoarthritis. The fifth, which is also very important and I think the most important factor or reason why you should avoid obesity is heart issues. When you have obesity, there is a spike in bad cholesterol and triglycerides. So what happens is when you have a spike, you also have a decreased good high density lipoproteins, and because you have less or decreased lipoproteins which are good in nature, the good high density lipoproteins, and you have a spike in bad cholesterol and triglycerides, you are possibly going to have heart issues. The other factor which I earlier explained was high BP. So obesity, when it leads to high BP, this also can lead to you have a high risk of having heart issues or heart attack. So now I have actually gone ahead and told you 5 factors. Number 1 was diabetes, number 2 was cancer, number 3 was high BP, number 4 was osteoarthritis, and number 5 problems. I've covered 5 factors as of now. In my next video, I'll tell you another 5 factors, and that will make in total about top 10 factors or reasons why you should avoid obesity. Avoid obesity, remain fit, and avoid all these parameters that can affect your health. Thank you so much.